up for questions.
Governor, why did you encourage why did you roll out that new positivity data and encourage school leaders to look at that when you knew that you already were aware that there were problems with the data?
So I became aware of it last week, and as I said, we were able to identify what the cause was. And so the data overall really had minimal change to it. And so we were able to, when you take a look at 90% of Iowans, approximately 90% of Iowans tested are negative, and then a smaller percentage is positive, and it impacted both negative and positive. And so as we were working to correct the logic so that it would be reported accurately to Iowans, as they walked through that process, there was minimal change to the counties that would be impacted. And the bottom line is, too, it didn't impact the contact tracing and the case investigation that takes place with the Iowa Department of Public Health, their team, and the local public health officials. So that was already taking place. That didn't change. The overall numbers didn't change. They were the same. The overall average positivity rate didn't change. It was the same. What it did do is actually, because of the high percentage of negatives that we see on a daily basis, it actually did, for I think 79 of the counties, it actually took the positivity rate down a little bit, and with the remaining we saw some increase, but less than 1% was a minimal change.
Dr. Pedati said that she was aware of it at the end of July.
Well, I became aware of it. Dr. Pedati, do you want to address that?
Yeah, that's right. At the end of July, we were aware that there was an issue with the date that was being assigned to individuals who had repeat multiple tests. And again, I know that this is hard, but as we move through this response, we continue to look at our processes, our tools, and the information we have available. And so it does mean that we have to make adjustments. It means that we have to be flexible, and we want to incorporate new information and adjustments as we move along. So I know that it's not ideal when things continue to change, but we do that in an effort to make sure that we're giving people as much information as we possibly can, as quickly as we can.
Governor, how can people trust the data? I mean, that's the biggest thing that the question we're receiving at our station is, how can we trust the data the state is putting out if they knew about this issue almost a month ago?
Well, I don't know if it's been over a month ago, but first of all, I think one of the reasons that they can feel confident in the data is we have worked very hard to provide transparency, to provide real-time data, and we've updated it as we've heard concerns or issues from Iowans on things that they wanted to see reflected on the website. We have an antiquated system, and with the system Domo and the system that we're able to utilize on the website, we are able to address some of the issues that is attributed to an older system. But I think, as you look at the data, you look at the numbers, it's remained consistent. And as we address new changes, new requirements, look for ways to provide new information to Iowans, some of that is going to occur. And that's not unique to Iowa either. Other states have dealt with some antiquated systems as well and have had to respond to that. So, we're transparent. It's real time. We've given Iowans the opportunity. They can go back and look at it. They have the opportunity to reach out and question some of the things that they might not understand on the website, and we've been able to respond to those.
Governor,
Dr. Pedati, do you have anything to add to that?
No, again, I think I would emphasize that the electronic reporting systems for public health are systems that we know have needed improvements for years. This is something we recognized long before COVID, and it's something that isn't unique to Iowa. I was on a conversation with a CDC colleague yesterday who reminded me that in 1994, electronic reports were being received by dial-up modem. We've come a long way since then, but we still have improvements to make. And I know that it is frustrating when adjustments have to be made, but we provide real-time data to the public and to anybody who visits our website which I think is unique. I'm not aware of any other state that does that. And we do that because we think it's so important that everybody can see what we can see. And so that does mean that when we find issues, we're going to recognize them, we're going to share them and work through them with everybody. And again, that's because we believe it's so important to share the information we have. But we know that we're going to have to make adjustments. We have before, and we'll continue to do that in the future.
Yeah, and I don't think there is probably any of you or any of the agencies that you work for that hasn't done an IT update, that hasn't experienced some glitches throughout that process. It's just, it's part of it.
Governor,
But
the
Governor,